Okay, let's jump right into this explainer. When we think about healthcare, our minds naturally go straight to doctors, nurses, and medical treatments. It makes sense. But behind the scenes of literally every single patient interaction is this massive, incredibly complex corporate structure. And today, we're going to explore exactly how that structure is held accountable.
But that brings up a huge, honestly, kind of complicated question. How do you actually put a number on a hospital's ethical compass? Trust is just such an abstract concept. When you walk into a clinic, you're trusting them with your absolute most valuable asset, right? Your health. But for a really long time, investors, regulators, and even us as patients had almost no way to quantify if a healthcare provider was actually operating ethically. How do you track something as invisible as integrity?
Well, it turns out the answer lies with something called the Sustainability Accounting Standards Board, or SASB. Specifically, their healthcare delivery standards. These are now managed by the International Sustainability Standards Board under the IFRS Foundation. Basically, this group realized that sustainability isn't just about, carbon footprints and recycling, though sure, that's part of it. In healthcare, sustainability is deeply, fundamentally tied to human impact, patient safety, and operational ethics.
Now, I know accounting standards doesn't exactly sound thrilling, but stick with me, because these aren't just dry financial codes. They are vital tools that trace the exact path of a dollar and a patient through the medical system. They force hospitals, clinics, and rehab centers to publicly report on some highly sensitive areas of their business. So yes, it helps investors assess risk, but more importantly, it forces the entire industry to hold up a mirror to its own practices.
So here's how we're going to break this down today. First, measuring healthcare trust. Then, managing controlled substances. Third, pricing and billing transparency. Fourth, fraud and unnecessary procedures. And finally, the accountability takeaway. Let's start with our first point, measuring healthcare trust.
You've probably heard the old business saying, what gets measured gets managed. It is absolutely true here. By forcing healthcare networks to publicly quantify these specific ethical dilemmas, the industry is literally forced to actively manage them. I mean, think about it. When a hospital knows it has to publicly disclose its terror rates, or data breaches or fraud settlements, suddenly those metrics get a lot of attention in the boardroom. Disclosure drives behavior. And nowhere is that more crucial than in our next section.
Which brings us to part 2, managing controlled substances. The healthcare industry sits right on the front lines of the opioid crisis. They are the prescribers and the primary caregivers. Under SASB code HCDY260A.1, a hospital can't just say, oh yeah, we're careful with medications. Nope, they must explicitly map out their operational defenses against addiction and mismanagement. Are they registering with jurisdictional drug monitoring programs? Are they actually training their staff on evidence-based pain treatment? How exactly are they storing and throwing away these highly addictive substances so they don't hit the black market? This metric essentially demands a complete blueprint of their preventative infrastructure.
And it goes a step further. Providers also have to disclose how they use life-saving opioid antagonists, things like naloxone and naltrexone. They literally have to prove they're equipped to counter the adverse effects of the very drugs they're authorized to prescribe. It's a completely full-circle approach to accountability. From the second a drug is stored in a cabinet, to how it's prescribed, to how the facility responds in an absolute life-or-death emergency.
All right, let's move on to part 3, pricing and billing transparency. Medical billing. We all know it can feel like a total black box, right? But I want you to focus on this number, 25, because this number represents a massive regulatory shift toward empowering us as patients. Under code HCDY270A.3, medical facilities must publicly reveal their prices for the 25 services they bill for the most frequently. This is based on their procedure volume over the last 3 years. And they can't just drop a list. They also have to calculate what percentage of their total services those 25 procedures represent. This is huge because it means a hospital can't just publish the prices for rare, obscure treatments and try to hide the costs of the routine care that actually impacts the vast majority of people. Providers also have to clearly explain how they talk to different types of patients about money. If you're paying out of pocket, the disclosure rules say the hospital needs to describe exactly how they ensure you're informed before you go into a procedure. Are they giving you an exact total, a percentage range, just a rough estimate? And for insured patients, the hospital must detail how they coordinate with your insurance company to define exactly what you will owe versus what insurance covers. It's all about eliminating that horrible surprise bill factor.
Next up, Section 4, Fraud and Unnecessary Procedures.
Medical fraud is a massive deal. It doesn't just harm patients, it subjects these companies to gigantic fines and legal nightmares. Mechanically, a lot of this comes down to two sneaky practices: upcoding and unbundling. Upcoding is basically when a facility bills for a much more expensive or complex treatment than you actually got. Unbundling is taking a single comprehensive procedure that has one billing code and breaking it apart into multiple separate charges just to inflate the final bill. The SASB standards are specifically designed to target these exact practices.
And these standards force hospitals to police a really wide spectrum of fraud. We're talking way beyond basic billing mistakes. It includes falsifying a diagnosis entirely just to justify an unnecessary surgery. It includes taking kickbacks to refer a patient to a specific clinic. And it includes phantom billing, literally charging for a medical service that never even happened, or double charging for the exact same thing.
The craziest part? Hospitals can't just sweep these failures under the rug as internal matters anymore. They are required to publicly report the total monetary losses and fines from these legal proceedings. Civil judgments, regulatory penalties, criminal judgments, all of it. And it's not just dropping a dollar amount on a spreadsheet. They have to actually describe the context of the fraud. Was it a settlement? A guilty plea? The level of transparency demanded here is absolute.
But just writing a check to pay a fine isn't enough. Entities must also document the specific, tangible corrective actions they took to stop it from happening again. It's one thing to pay up, it's another to prove to the public that you actually fixed the leak. Did they fire the bad actors? Did they upgrade their billing technology? Did they cut ties with a shady business partner? The standards demand literal proof of systemic change.
Finally, Section 5, the accountability takeaway.
So let's tie all this together. Why does this matter? Because these disclosures aren't just corporate red tape. They are the ultimate proof of a hospital's accountability when it comes to your safety, your wallet, and your trust. By tracking how a facility locks down highly addictive controlled substances, we see their real commitment to the community. By forcing them to publish the prices for their top 25 procedures, we take the mystery out of medical bills. And by dragging medical fraud into the daylight, we ensure that profit doesn't override actual medical necessity.
Which leaves us with this final, critical thought to chew on the next time you interact with the healthcare system. The SASB standards give us a window into the soul of these massive organizations. They prove that ethics can actually be measured. Because at the end of the day, if a healthcare provider won't be transparent about their ethics on paper, can you really trust them with your life in the exam room? Thanks for joining me on this explainer. Keep asking questions and keep demanding transparency.